For Action News, I'm Anna Samowska. The number of young American adults taking medication for ADHD has nearly doubled from 2008 to 2012. Now that's according to a new report that says 2.6 million adults were prescribed drugs like Adderall or Concerta in 2012, compared to 1.7 million in 2008.
These numbers are really astounding. If you look at the specifics, we see that the number of adults receiving medication to treat ADHD has risen 53% from 2008 to 2012. The number of young adults, which is classified as adults ages 26 to 34, has almost doubled.
If left untreated, ADHD could have serious consequences, but many experts question the validity of the number of cases reported.
There is absolutely no way that the number of people with ADHD has actually risen this much over the past 4 years. There really has to be some other explanation at play to explain why these numbers are becoming so high.
It's a diagnosis easy to obtain, and it's a popular trend among college students who don't actually suffer from the disorder.
There are really three main industries that are driving this, and this is really all about money, or mostly about money. First of all, the drug companies that sell the medications for this. And they're the easiest to blame, and they do deserve some. But the mental health industry has to take its share of blame on this. Also, this may sound cynical, but once something appears in the DSM, it becomes a real disease. It becomes something you can bill insurance companies for, or Medicare, and it will be covered. So I don't necessarily want to imply that psychiatrists are purposely padding this book to make more money, but it's certainly a plausible explanation, just as it would be for the drug companies. And then, maybe not as obvious, but probably just as insidious, is the fact that the ADHD industry exists at all. And one of the ways this manifests itself is you go get a diagnosis of ADHD. You're 19, you're 20. All of a sudden, you get extra time on your exams at college, you get extra help, and a whole host of things start to happen, all of which begin with a diagnosis from a psychiatrist who is now able to put down a code for this disease for adults. There may be an unrecognized need for ADHD treatment for adults, but the chances that it has increased so quickly over the last 10 and 20 years are really very unlikely. So I think what's driving this are external factors.
To read more on this story and others, you can head to our website, acsha.org, that's acsh.org, and while you're there, go ahead and sign up for your daily dose of news delivered right to your inbox. For ACSHA, I'm Anna Samowska.